Hello there, and welcome to another episode of our Facebook series. I'm Dr. Samantha Durland. I'm board certified in obstetrics and gynecology and anti-aging and regenerative medicine, as well as fellowship trained in metabolic and nutritional medicine. All right, so now that we've gotten that out of the way, today what we're also going to talk about is breast implant illness. We've done another series or another episode about this, but today we're going to kind of address some additional questions that we've had about it and some other perspectives. And so we did have the opportunity to talk to Dr. Ron Bergman in Des Moines about some considerations about perioperative considerations with breast implant illness, and I'll address those today, as well as the kind of the principle of functionally how to help your body around this surgical entity so that people are aware of what their options are. So first, let's talk about what to expect with a surgical procedure and what that postoperative course looks like, because it could be scary, but no need to be scared. People do quite well with this. So at the time of your surgical management, preoperatively, you'll see your surgeon, and we'll talk about the procedure, get your surgery date scheduled. The evening before surgery, just like when you put your implants in, you don't want to eat or drink anything after midnight. You want to reduce any of your medications or supplements that may increase the risk of bleeding, and that would include a lot of omega fish oils. That would include aspirin or any anti-inflammatories such as ibuprofen. Also, so many times we try not to have you smoke for 30 days beforehand and 30 days afterwards, because we really want really great vascular flow and healing. And when you smoke, you actually cause vasoconstriction of the blood vessels, which could impair healing of the tissue. And so certainly we're trying to get the best cosmetic and the best healing result. So to stop smoking before and after is important as well. During the surgery, and the surgery usually is done as an outpatient, so you get to come in and go home the same day. You don't have to stay in the hospital for an extended period of time. I've also had other questions from patients, is it covered by insurance, is it not? And I think you really have to check with your insurance plan to see, but at this point in time, a lot of times it's not covered, I would say, but I can't speak for your plan, and you need to contact your individual plan and ask them that question. Certainly to realize having any surgery in any facility, there's multiple bills that are generated from your facility, and that would include the anesthesia fee. That also includes the facility fee, and then that also includes your surgeon fee. The reason I bring that up is there's nothing like anyone being surprised about how much this is actually going to cost. It's already a big deal. You don't feel good. It's an emotional experience as well. And certainly having any surprises financially doesn't assist in our recovery or well-being. So just know that there's a lot of times in medicine when you have a surgery, there's various bills that are generated. And certainly if you are having a cosmetic surgery, or a surgery that's not covered by insurance, the time of your procedure is also something important. And not everyone's surgical procedure is going to take the same amount of time, which is going to vary cost. So in speaking with Dr. Bergman, he had articulated that you would want to anticipate your surgical procedure being about 2 hours. Now, if your surgery goes really straightforward, there's not a lot of scar tissue, maybe it takes less. So you might not have to pay as much for the facility fee. Now, maybe you have a lot of scarring, and maybe it's going to take quite a bit longer. So your surgical procedure might actually be a little bit more expensive, but that just has to do with time, and you just don't know until you get there. So don't let that variance surprise you, because I know whoever is doing the breast implant or the breast explant is also being very passionate about taking the whole capsule out, because you want to minimize the risk of leaving anything behind that is going to cause your body kind of an immune reaction or an autoimmune reaction or an inflammatory reaction. So the removal of the complete capsule is very important. Now, post-operatively, it may take about 4 weeks for someone to be able to return to a pretty physically robust employment, if you will, where you're doing a lot of lifting and you're going like this because, gosh, this is your chest, and going up and down with your arms. It's just challenging. But if you're going back to more of a seated position where there's not a lot of lifting, you certainly could go back within a few days. But if you have a really physically strenuous job, it's about 4 weeks is a rough time period to kind of count on. And then I've also heard about various people wondering about reimbursement for their breast implants. And so you hear about that with some type of implants and not others, but I would just advocate that you want to contact the manufacturer of your particular implant and see if this is an option for you, because it has been an option for some patients, but you don't know until you figure out your specific situation and what applies to you. The other thing too is that we talked about nicotine. Sometimes afterwards, people can be kind of restrictive about like temperature, again, the smoking, but you can start back on anti-inflammatories after a few days. But again, you want to check with your physician because they will give you some guidelines so you know exactly what to expect, what to do, what not to do, and never feel scared to reach out and ask questions because it's very important. The other thing that you'll hear is some people will actually some physicians will put will do some cosmetic surgery afterwards, other ones will not. And speaking with Dr. Bergman, his personal preference is to not do any sort of lifts at the same time as an explant, because it brings up a great point, such that what I've seen surgically when I'm doing surgery on patients is that when you do a procedure and you're removing something that causes inflammation, the tissue is distorted when you start. So if you have an infection, if you're having a reaction against something, your body is swollen. So what you're doing at the time of surgery is not only you're taking that out, but the swelling needs time to go down to see where the dust settles, if you will. And if you're trying to cosmetically change tissue that's edematous and abstract, you have a variable that as that goes down, maybe what you saw at the time of surgery is not actually what you would have done over here, because that swelling distorted things. And I really don't think anyone wants like inequality of their chest or to come back and feel like they want to feel their best sense of self. So a lot of times he recommends going back afterwards to readdress those issues. Although I know you'll just have to discuss that with your surgeon because everyone is different and everyone has different expertise. As far as detoxing and just healthening up your body around, we also acknowledge that this is a very emotional time for people because people go into having breast implants for a reason. And if they remove that without processing what it all means, it's so challenging. So we try to help people process through that. We also medically, what I love to do around the time of their surgical procedure is medically just look in their body and try to find areas of efficiency, like where the body metabolically may have been a little bit inefficient. Some other issues that may be going on with the body, because that just helps a patient recover more fully from the explant surgery. Because a lot of times when people go into having explant surgery, they will say, I'm tired, I can't remember and concentrate, I'm swollen, my sleep is off, I don't feel like myself. Well, those symptoms are symptoms that I see in patients every day for a myriad of different reasons. And even though patients may have a breast implant, how do you know that that implant is actually what's causing you the problem? Plus, sometimes you remove the explant and you still don't feel well. So as a physician, I don't know if you don't feel well because of your body's reaction that it did to the explant or the implant, or you have something else going on. So certainly once someone makes the decision that they want to change their life and feel better, they don't want to just feel a little bit better. They totally want to feel better. And so looking at your body holistically around the surgical procedure perioperatively, you can't go wrong with, and it's super cost effective and can only help your body find energy for the healing and recovery process. So the detox that we do is more of a mental detox. We do a physical detox. We look at your body for energy, help restore the body's health to what is within our control, and help the patient navigate the system with the least amount of confusion and feeling overwhelmed. And, I know when we're going into this, everyone's always concerned about cost and things like that, but we've really tried to be very passionate about controlling that as much as possible and being as transparent as possible, because I'm just a human being. I'm a woman, I'm a mom, and we're just here to help people have a good day. And everyone deserves health in their life. And once someone has the intent, we're just super excited to be part of their pathway of improvement of their life and their trajectory of life. So thank you so much for joining us. Hopefully that was super helpful information. And don't forget to go to our website and find out more information, or if you have any questions, reach out to us. So I hope you have a great day, and we'll see you for our next episode.